again. Does anybody have any questions for me?
In the event that you're the only one setting up, can you open the sterile tools and dump them on the tray before gloving, or would you glove and then change gloves out?
No, I would dump everything on my field first.
And then glove up?
And then glove up, because once your hands are sterile, you can't do anything else, and then you can't even call for help unless you want to designate a hand. And you run into trouble because if I designate my left hand as dirty, once that left hand is dirty, I can't do anything with it sterile. I have to make sure that it doesn't touch anything, and sometimes you forget and you grab and you go, oh, I have to start all over again. And it's with practice. I find that there's only a couple of things like Foley catheters. I find that I have to designate a hand because, you know, with women you have to move things out of the way to see. And once you touch, that hand is dirty now. So you can't use this hand to touch the catheter. You can touch the outside package of the Foley, but you can't touch the catheter itself because now this hand is dirty. So, you know, there are some things that, you know, you have to kind of use one hand, but then you have to remember. So I always make it a rule, and it's just a personal rule, that my left hand is always dirty. No matter what I do, my left hand is always dirty because this is my dominant hand. This is the one I do everything with. And, you know, once you guys get into practice and you're a little more comfortable with your skills, you'll find comfortable ways to do things. And that's all it is. It's a way to remember to not touch with the wrong hand, or to not, to work with the more comfortable side. Any other questions?
In the event that you're catheterizing your patient, because you have to move things out the way, when you're done you would have to change your gloves, right? Or is there a way to do it?
There is a way to do it, and it's not an easy way. I always use my left hand, and I always stand on the right side of the patient, bring my bed up, and I'm always reaching this way to do this with my catheter. So this hand is dirty. This one I'm using to clean, and you can use forceps to clean to keep your hands away from the dirty. So you can use this hand to open and this hand to clean. What do you do now? Okay, for the Foley catheter, so I have my betadine solution, my cotton ball, and my forceps. I'm cleaning. What do I do with this dirty cotton ball? Say it again?
Bio.
Bio. What do I do with it if I don't have a bio? Where can I put it to keep it out of my way?
I'm not sure the medical way, but once you open that sterile package, you leave everything in there that needs to be thrown away.
Right. You can drop it off into the package that you have aside. You can drop it into one corner of the sterile field, away from everything else. You can, I drop things on the bed a lot because I'm going to change it anyway, and most of the time you have chucks or something there. Mm-hmm. There's, what comes with the kit for catheterization is the little white paper thing. Mm-hmm. There's two of them. There's one that goes over the patient's private areas, and there's another one that goes up underneath the patient. Mm-hmm. I drop stuff on that all the time because as I'm cleaning up, I'm doing this. And then I'm pulling my gloves over it and I'm throwing everything away. But it keeps it off of my sterile field. Urinary tract infections are most common in patients who have Foley catheters, and a lot of it is that the sterile technique has not been maintained. Same thing goes with IV starts. Most of the time there's infection, it's because somebody cleaned and then touched to find the vein and then started. Well, once you touch with your finger, it's dirty again. You have to re-clean it, and that's the hardest thing to not do, is touch it before you put the needle in because you're feeling for the vein. It's really hard. Sterile technique is important. And it's not just the sterile technique, it's the aseptic stuff, it's the stuff, it's keeping everything clean, because once you put a hole in somebody's body for whatever reason, you've opened a portal for germs. And somebody who's compromised or old, who doesn't have a really good immune system, they're at risk for really bad infections, and sometimes it takes hold and it goes really quick. Mm-hmm.
Okay, so after you know how you put the white thing down the sterile field, right? So you're not supposed to drop the gloves on the sterile field. You're supposed to do that somewhere else?
You can drop the gloves on the sterile field. I prefer to do it someplace else because if I accidentally drop the paper on my sterile field, I have to start all over again. And I've done it so many times, drop something on there, that I've just gotten into the habit of going, you know, to the side. Most of the time I'm putting it on my patient and taking them that way. Or there's a little table, sometimes you use that, or the bedside table. But I've gotten out of the habit of doing it on the field. You can, there's nothing wrong with it as long as you're maintaining sterile technique and dropping it on, but I've had too many mishaps. So I stay over out of the way. Anybody else? No? Well, thank you very much for having me, I appreciate it. You guys are great.
Thank you.